Hello everyone, welcome back to my channel. Here are some legal terminologies used in nursing, legal or ethical terminologies used in nursing that are very important by meaning also and very important in application also. Let's get started with the video. First terminology is assault. Assault is an act of threatening someone either physically or psychologically. Assault is an act of threatening someone. It can be also explained as putting a person in immediate danger or in apprehension. Battery. This is the next terminology. Battery can be defined as act of harming someone physically. Assault was threatening to harm. Battery is act of harming. It is an offensive touch or using force upon someone without consent. Tort. It is harming an individual or their property. This is a wrongful act that might bring damage either intentionally or non-intentionally, but usually intentionally. Harming an individual, their surrounding, their property can be known as tort. Next is negligence. Negligence is next word for carelessness. It is inability to fulfill basic duty properly, or if we want to define it in terms of nursing, it can be said as inability to provide proper care to the patient. Negligence can also be explained as a being not responsible or being irresponsible for something that we should be responsible for. Malpractice. Malpractice is an improper or unprofessional behavior. When a professional is not able to exercise their skill, then malpractice occurs. Fraud. Fraud is an act of deliberately trying for unlawful gain. When a person tries some way or the other to gain something illegally, this can be called as fraud. False imprisonment is an act of restricting a patient against medical prescription. When a person who is suffered from either physical or psychological illness is imprisoned or restrained without the prescription of doctor, this can be called as false imprisonment. Invasion of privacy is invasion into sensitive or private information of patient and sharing it to some unauthorized person. Authorized person who has to know that information can be nurse and doctor working together in the same team. And the person who is unauthorized to that information can be anyone except the nurse and doctor, anyone else from the team, or media, or any other member of the hospital. Invasion of privacy can lead to harmful results for both the health personnel, any of the health personnel actually. Sharing patients' private information without consent to any unauthorized person can be harmful, can be dreadful. I would like to explain one example for each. If nurse tries to threaten the patient for hiding or mistake, this can be called as assault. If nurse deliberately tries to harm the patient, tries to hit the patient or tries to provide harm to the patient, it can be said as battery. If nurse harms the individual or the individual's property, patient or patient's property, intentionally or unintentionally, it can be called as tort. When a nurse or a health personnel are unable to provide the nursing care properly, and they are called as, at that time, they are called as a negligent professional. Example for this, a specific example for this can be while providing IV therapy, when the pint is finished, the nurse is supposed to stop the flow. But if the nurse fails to stop the flow on time, backflow occurs. We can see the blood in IV lining. That can be called as act of negligence. Malpractice. Now this is an unprofessional behavior. Treating the patient in a way that health personnel is not supposed to treat, or behaving the person in such a way, behaving with the patient in such a way which seems like assault, which seems like verbal or physical assault, can be a malpractice. If nurse tries to gain something from patient illegally, deliberately, continuously tries to gain something from the patient, then the nurse or any other health personnel can be called as a fraud. When nurse tries to restrain any of the patient suffering from any disease without the prescription of doctor, that condition can be said as false imprisonment. If the nurse receives any sensitive information about the patient, history of the patient like sexually transmitted disease, history of the patient like having extramarital affair, or history of the patient regarding any other thing, then if she shares that same information with any unauthorized person, that can be said as invasion of privacy. Thank you so much. Next topic will be explained in next video.